Okay, so today we're going to be talking about the importance of face coverings. Now, we're still going through this coronavirus pandemic, and I know Governor Baker issued a mandatory requirement to wear face mask coverings or facial coverings in public. Now, can you tell me how can wearing a face mask prevent the spread of COVID-19?
Okay, so this is a complex issue. I'm going to break it down in a few different parts. I'll start with just reviewing how COVID-19 spreads. So the principal way that COVID-19 spreads is through these tiny respiratory particles that are emitted from the mouth or the nose of an infected person when they cough, sneeze, or even just talk. So these particles that are called droplets fall to the ground or onto surrounding surfaces within about a 6-foot radius of the infected person. And that's where our 6-foot social distancing comes in. And the infection would be transmitted if the droplets enter the eyes, nose, or mouth of a nearby person, or if that nearby person touches a surface that's been contaminated with those droplets and then touches their eyes, nose, or mouth. So the primary purpose of wearing a face covering is to contain those respiratory droplets.
Okay, perfect. Now, is there any other diseases that could be preventable other than COVID-19 from wearing a face mask?
Any respiratory virus that's primarily transmitted by these droplets would be potentially prevented by wearing these type of face coverings. In COVID-19, it's particularly important because what we know now is that people who get a COVID infection are contagious from 2 days before they start having symptoms to around 10 days after they start having symptoms. And we also know that a large percentage of people with COVID-19 with active infection have either minimal or no symptoms. So the primary purpose of advocating that members of the community at large wear masks is to reduce transmission from people who are unaware of their infection, either because they were just recently infected and they haven't developed symptoms yet, or because they're part of that, 30 to 40% of adults who don't have notable symptoms.
Now, what's the transmission probability of someone wearing the face covering communicating with someone who isn't wearing face covering?
Sorry, I didn't understand the question well. Say it again.
So how can, are you protecting yourself more when you're wearing a face mask, talking to someone who isn't wearing a face mask? Like, what's the risk of being affected by COVID-19 if you're communicating with someone who isn't wearing a face mask?
Oh, I see. Okay. Yes. So the primary purpose of wearing a face mask is contain your own respiratory particles. It's about source control. It's about preventing transmission from people who unknowingly are infected. And so, some communities have used the slogan, "My mask protects you, your mask protects me." That's even though wearing a face covering yourself may provide some level of protection to the wearer, but it's primarily about source control. It's primarily about preventing transmission from infected persons.
Now, I know that there's so many different types of face coverings. You have the blue ones, the surgical masks, the N95s. What's the difference between the masks and what do you prefer people to use?
Okay, so that's a great question because when we're talking about masks, there's a variety of different types. So cloth face coverings are often homemade and they can really vary widely in terms of their filtering capacity, which probably depends mostly on how many layers of cloth they contain and what is the type of material used, how close-knit the weave is. So surgical masks, here's an example of one. These are used in healthcare settings, and they're used to prevent the spread of other common respiratory infections like influenza, the seasonal flu. And they're made of really tightly woven material, and they also have a waterproof barrier, but they don't filter out all particles because they're open around the sides. And then this is in contrast to something that's called an N95, also called a respirator. These are used, here's an example of one of these. These are used in healthcare settings to take care of patients with known COVID-19 infection, and they provide a physical barrier, also an electrostatic barrier that filters out even the tiniest particles that are less than 5 microns. And these need to be fit tested to ensure that there's a perfect seal around the nose and mouth. So when we're talking about a mandate for community-wide facial covering, this has to do with cloth face coverings primarily, and then surgical masks that people may buy. And this is really what we're talking about, not the use of N95 respirators.
Right. How often should people change their masks?
That's a good question, and I don't think that has been really well studied. In fact, a lot of the information that we have relating to the community-wide mask use is pretty recent because no one has studied this before. I think probably whenever it's visibly soiled, but I couldn't give you a better answer.
It's okay. That's understandable. Is there anything that we didn't discuss that you'd like to add, or?
Yeah, I think a couple of different things. So what is the evidence that we have that cloth face coverings are effective in controlling the spread of COVID-19? As I said before, we haven't studied this extensively because mostly we've studied the types of masks that are used in healthcare settings. What we do know is that some epidemiological studies have tried to look at countries that were more successful in containing COVID-19 and where mask wearing was a social norm, for instance, in South Korea. In those studies, even though there was a high percentage of the public using universal masking and they were more effective in containing the virus, it's really hard to tease out what was the particular effect of masks versus the many other public health interventions that they implemented at the same time. We have seen just last week, there was a study published that showed that in a large health system, let me back up. In terms of evidence that masks control the spread of COVID-19, many healthcare settings, including Bay State, have mandated universal masking of all employees, regardless of whether or not they have COVID symptoms and regardless of their role in patient care since the beginning of the pandemic. And just last week, there was a study that was published that demonstrated that rates of COVID infection among healthcare employees in a large health system in Boston started declining as soon as they had the requirement for universal masking. So as soon as that requirement was implemented, rates among the healthcare employees started declining even as infection rates in the community rose. So that's indirect evidence of the efficacy of these types of face coverings. I think that wearing a face covering is one of several steps that members of the community can take to slow the spread of COVID transmission. And there's evidence that it's helpful, particularly in a situation where a physical distance of 6 feet cannot be maintained. But it's really only one intervention. It's only one of many interventions that need to be undertaken simultaneously. So physical distancing, meaning just maintaining that distance of 6 to 10 feet, is probably the single most effective means of protecting oneself from COVID. Frequent hand washing is important to prevent inadvertently introducing COVID into the eyes or nose in the event that you've come into contact with a surface that's contaminated. And maintaining good ventilation in indoor areas is similarly important. So I think one thing to emphasize is that wearing a mask is not a substitute for physical distancing. It may provide some level of protection to the wearer, but it's definitely not 100%. If I'm wearing a cloth face covering and if I come into face-to-face contact within 6 feet of a person with an active COVID-19 infection, it's still possible for me to become infected, either because the respiratory droplets enter my eyes that are not covered, or because the droplets go around the mask, or maybe the mask doesn't filter those types of particles. And in addition, if you look in the community, you'll often see that people are wearing a mask below their nose, which is not an effective way to wear it. So I think that in conclusion, I mean, wearing a face covering is most important for source control, meaning to prevent transmission from people who are infected, but who have few or no symptoms, or who are in the 2-day window before they develop symptoms. And it's not a substitute for physical distancing, but it complements physical distancing.
Well, thank you so much for sharing your insights on how important it is to wear face coverings, because I think it is very essential for the public to know just how effective it is during the pandemic.
Yeah.
So much for joining.
Thank you. Take care.
Working for you, I'm Jada Furlow, 22 News.